Hi, my name is Semaan, and I'm a licensed psychotherapist. If this is your first time joining me, welcome and thanks for being here. If you've been to my channel before, thanks for tuning back in. Today, I'm going to talk about addiction. I'm going to define addiction, and I'm going to help you understand better what happens to us psychologically when we experience issues with addiction. So if you want to learn more about that, stay tuned. Just a reminder that if you found yourself enjoying this video, please remember to hit the thumbs up button, leave a comment in the comment section with any questions or comments or feedback or suggestions for me, and subscribe to my channel for more videos. What is addiction? Contrary to what people think, addiction is not a choice. It is not a reflection of a person's character. It's not a reflection of a person's willpower. Addiction is a disease. We have a lot of data and evidence-based research that supports that addiction impacts people differently, which is why it's classified as a disease, because a person who struggles with addiction, the way their mind processes the behavior or the substance is very different from how another person who doesn't have the addiction disease processes those urges and those behaviors. Now that we've defined that addiction is a disease, I think that's a very good starting point, because now we can have an intellectual conversation that isn't about blaming the person struggling with the addiction, because a lot of the barriers to help have to do with stigma and have to do with the negativity that surrounds addiction and the lack of good information out there about addiction in general. For the sake of this video, I am not going to differentiate between addiction to substances and addiction to behaviors. So some examples of substances are alcohol, drugs, prescription medication. Addictive behaviors could be something like gambling or what we call PMO, which is porn, masturbate, orgasm. That PMO is a sex addiction. So any of those behaviors or substances, for the sake of this video, we're going to call addiction, and I'm not going to go into the specific details of each one. What are the main signs of addiction? The first one, and the most important one, which helps us as clinicians diagnose an addiction, is the loss of control over the behavior or over the substance. What that means is that the person spends a lot of time seeking the substance or seeking the behavior. So people may avoid going to work, for example, to make sure that they have enough supply of heroin. Or a person may spend an entire day in the casino gambling. Or a person may spend hours watching pornography on the internet. Those are all examples of how a person may feel a loss of control over their substances or their behaviors. Going with the loss of control is what we call cravings. Cravings is a very strong biological, physiological, and psychological reaction that a person experiences when they have a really powerful urge to either use a substance or to engage in a certain behavior. Those are what classify as loss of control when a person is struggling with an addiction. Just like any other mental health disorder, and if you've seen my other videos, you know that I mention this in almost every diagnosis video, it has to significantly impact areas of functioning. What I mean by that is that a person can no longer care for their responsibilities the way they once did as a result of that addiction. So they struggle with going to work, with maintaining their family or home environment, with maintaining social activities and events. So these things can be really impacted when a person is struggling with an addiction to a certain substance or behavior. Other signs of addiction are risky use. So a person uses the substances or engages in the behaviors without a lot of regard to how they will affect them physically or psychologically. And the last sign of addiction is the physical effects. This is especially present when we talk about addiction to substances. You've probably heard the word tolerance before. Tolerance is when a person struggles with reaching the desired feeling that they get from a certain substance or behavior. So they continually start increasing the amount or the frequency of that substance or behavior to build tolerance, to increase that threshold, because they're no longer getting the desired effect from it that they once did. So to recap, the signs of addiction are loss of control over the substance or behavior, engaging in risky behaviors psychologically or physiologically, feeling that multiple areas of responsibilities in our lives are affected, and the physical effects that we could experience, such as building tolerance. Addiction is made up of 6 different stages, and those stages are what we call stages of change. A lot of the messages that a person who struggles with addiction hears is that you need to stop. You just have to quit cold turkey the substance. You need to stop going to the casino. You need to stop watching porn. If it were that simple, no one would be addicted. So I want to help you understand what happens to us psychologically when we experience addiction, and that's divided into 6 different stages. The first stage is what we call pre-contemplation. That's when a person doesn't even recognize that they have a problematic behavior towards a substance or just a behavior in general. People who are in the pre-contemplation stage probably say something like, "Why should I change? I don't have a problem." In other words, a person is in denial that whatever they're struggling with is problematic to them and to their lives. The second stage of change is called contemplation. That's when a person may start feeling like, maybe I do have a problem, but I'm not even sure where to start. So at this stage, we see people talking to friends and family and loved ones about either their problematic behavior or their issues with a certain substance. So in other words, we see a lot of talking about it at this stage, but maybe not a lot of action steps yet. So they're not really sure where to start. The third stage is the preparation stage. This is where a person starts to recognize that yes, there is a problem and I do need to take steps to change it. So some of the typical steps we see here is people researching the names of therapists, people researching any support groups like Alcoholics Anonymous or Narcotics Anonymous or Sex Addicts Anonymous. So these are some of the behaviors we see in the preparation stage. The fourth stage is the action stage. That's when a person not only recognizes that they have a problem, not only is researching and looking for help, but is actually taking active steps. This is a person going to AA. This is a person going to every scheduled appointment and making little efforts every day in their life, or sometimes even huge efforts. I don't want to undermine it by saying little efforts. This is when a person does a lot of action steps, a lot of tangible efforts that someone from the outside looking in can see that this person is working towards recovery. The fifth stage of change is the maintenance stage. That's when a person starts to feel that whatever positive changes they've made in their lives is starting to affect them in a really good way. This is when a person feels like their life is so much better since quitting the behavior or quitting the substance, and they feel like they want to feel like this forever. In the maintenance stage, it's important to recognize that people may still face challenges with the addiction and the urges, but in the maintenance stage, it's much less than where it used to be when a person was actively using or engaging in behaviors that are addictive. The sixth stage of change is probably the most important to recognize because it can happen at any time in a person's life who struggles with addiction. And that stage is called relapse. Relapse is when a person falls back into the behavior or the substance that they were able to abstain from for a certain period of time. So if a person had been addicted to alcohol for 5 years and then was clean for about 1.5 years, but after that 1.5 years, there was a very stressful event and the person fell back into the pattern of drinking, that's what we call a relapse. It's important to recognize that relapse does not undo all the hard work that a person did before and was able to succeed by abstaining for a certain period of time. And relapse is just a realistic part of every person's life who struggles with addiction. Relapse is normal. It doesn't mean that the person failed. It doesn't mean that the person can no longer recover. It just means it's part of the cycle. and it's a step backwards, but it's not the end of the world. People can still get help and can still go back to regaining full recovery from their addiction to a substance or a behavior. If nothing else from this video, I hope the takeaway is that addiction is recognized as a disease and not as a choice, and that it's normal if we struggle with addictions. It's normal that we want to get help and seek support either from loved ones or even better from professionals. So I hope you enjoyed today's video. I hope that you learned more about what addiction is and what the stages of change are. And I look forward to seeing you all in my next one.